Welcome. My name is Corinne Waldo. I'm the Senior Director for Economic Vitality at the Boulder Chamber. Thank you for joining us for the April 22nd version of the Cross Industry Update here in Boulder County. We are in level blue on the dial. The dial did move to Boulder County operating it, but we are in level blue. Lane will go through all of that, what the future holds. We'll answer questions as we normally do. Please put them in the Q&A function. If you can only reach the chat, I could probably get them in there, but we prefer the Q&A. If you emailed me your questions, I'll try to ask those on your behalf as well. In the meantime, let's just hand it over to Lane.
Thanks, Corinne. Thanks all for joining, and happy Earth Day. I'm going to run through a very similar agenda of what we've done in the past weeks with our EPI update, where things are at with dial status, and talk a little bit about 5-star and have plenty of time for questions and answers. So Corinne shared this. We are in level blue. This is a map also to the right of the slide that shows all the different counties who've moved from that state order to a local order. And so that's really pretty much the entire metro area. And for Boulder County specifically, we've basically adopted the order that had been in place. So that dial 3.0 is what is in effect for Boulder County. It just that we moved into the blue status for that dial. That being said, we're still seeing, looking at the metrics from the dial status, we still are seeing our incidence rates in that yellow level. They have come down, which is good. It was about 141 last week. I think it was even 170 the week prior to that. So we are seeing that trend start to come back down, which is good. And it's even come down a little bit from where it was earlier this week. Our positivity numbers have also come down. It was at 4.8% last week. I think it was at 4.4 earlier this week and 4.2 now. But one of the challenges with that is we've also seen a pretty significant drop off in testing. So that's a concern. And there will come a point if we don't have adequate testing numbers that our positivity will not still be a good measure. But again, as we move, hopefully all the way through this next month, into kind of the middle of May, when we're projecting to move out of the dial and into that clear operating status, we will be specifically just tracking daily hospitalizations. And so this is not that same metric, but the overall kind of trends with hospitalizations, we've seen 11 days of decreasing or stable admissions. But overall, we'll be looking at that daily admissions is going to be our driver. So here's that epi curve that we've been showing for a long time. And you see the biggest spike that occurred there in November. That was the time where we would have been exceeding the hospitalizations that would have been jeopardizing kind of our clear status. That's really the only time Boulder County has seen that issue throughout the whole pandemic. So again, even though we've seen these upticks since November, you can see where the latest uptick that we're starting to recover from is still significantly below where we hit in November. So that is all, again, favorable trends. Again, we've been tracking what our breakdown looks like across our community. 32% of the cases in Longmont, 43% in the city of Boulder in the last week. So again, a little bit of an uptick there within the city of Boulder, based on what its actual population is for our county. So 210 cases within the city of Boulder, 145 in Longmont, 60 Lafayette, Louisville, and Superior. And then our other municipalities and unincorporated county combined for 55 cases. So still we're not dropping down as low as we'd like to be, but hopefully again, we've turned that corner from that upward trend that we started to see. We are still seeing disparities in our community, specifically within our Hispanic Latinx community. So that is still something of a concern. And even in the last few weeks, last week, seeing an uptick in cases. So that, again, continues to be a concern there. So here's again tracking kind of some of those disparities in cases among the Hispanic residents, kind of, and seeing that again rising in April, where we had started to see a positive trend after the beginning of the year. That February and March we started to see that drop off, and then now unfortunately April we're seeing it kind of reverse. I think this is good news to share. We're over 166,000 residents vaccinated with either full or partial course. So that is great. That continues to go well. We are hopeful that in the next few weeks that vaccine supply is going to continue to ramp up and that we'll see those numbers go up even faster. So again, that's the most important part as a solution to all of this, is getting vaccinated. And our biggest concern right now is that especially between kind of the 16 to 30 and even 30 to 50-year-old age demographics, they're slowing down and getting vaccine. And that's the group that has been held out the longest to get vaccinated. So we really need folks to get vaccinated in order to effectively address this virus. You can see percentages kind of break down by different age demographics. So we've got, again, very high percentages of our highest risk populations. And, we're starting to see better and better vaccine numbers. But again, within our younger age groups, certainly the 10 to 19 is lower because not all of that age demographic is even eligible. But as we look at 20 to 29, we definitely need to start seeing numbers get 70 to 80%. Those are really our best targets. So we still have a significant number of the population that we really need to get vaccinated. And we're still seeing those disparities across those age demographics, where our BIPOC population definitely is not as represented as we need it to be. So again, a big concern, and we're going to continue to target our vaccine clinics that Boulder County is doing towards those populations. And we're using our GIS tools to help us navigate within the county where do we also need to be looking for our lower vaccination rates across all of our age groups. Want to continue to plug as resource the state's sites for vaccine, and definitely at the end I'll share our call center number. That is another important resource to help you identify where you can get a provider for a vaccine. So again, just summarizing, our case numbers are starting to decrease again, which is very good. Seeing those daily case counts come down, which is very important. Most of our age demographics have decreased with case rates, but we are seeing a rise again in the 18 to 22-year-old. That's again one that's a concern, and there's a big push certainly for the CU population to get vaccines in the students, especially before graduation and folks head out. Unfortunately, again, seeing that rise in disparities for the Hispanic Latinx community, and seeing those case counts be very disproportionate to the representation within the community. Well, again, 60% of our eligible residents have already been vaccinated, so that's good. We again want to keep that number climbing. Love to get to 80% of our population. And again, most of our higher risk age demographics have been vaccinated, so that is definitely was our highest priority. And then our disparities among our population for vaccines is still very present. And then I mentioned in the slide earlier about our testing numbers that we're seeing those decrease. And even though our positivity rates have decreased, again, we don't want to lose completely our testing numbers until we have really effective vaccine. So next steps, I'd shared this last week, but I want to cover it again. We are in the current dial until May 16th. And so barring major changes and surges in what's happening within our hospitalizations for COVID, we are expecting to move to clear and stay in clear through the summer. Again, we'll be monitoring those daily admissions to the hospital as our metric. But again, we have not seen anything that's concerning, and the last time was in November. So we'll be monitoring all the same metrics, but the biggest one will be what's happening at our hospitals. So we expect to be in clear and don't see anything that's gonna deter that. So we just have basically less than a month to kind of weather the rest of the storm, and then we will be sharing any other components that might happen beyond May 16th. So the only thing that I can see forecasting is potentially still use of masks indoors until we're through the summer. And our hospitalizations as well as our vaccination rates will be big determinants in that. So this, again, shared all that this is kind of where we're at. And then again, as of August 15th, assuming everything goes as we hope it will, that clear, which really is back to normal, it will be completely kind of back to our new normal. 5-star I wanted to cover because there's been some there was an update that happened shortly after our meeting last week that the 5-star committee did approve those businesses to operate in what has been termed 5-star clear. So it's not exactly the full clear dial status. And specifically for restaurants, it is reducing the distance between those dining parties to 3 feet. Still very much encouraging 6 feet where that can be maintained, but it would allow those 5-star restaurants to have a 3-foot separation between the dining parties. And then there's a clarification that for large events, venues, so this is not houses of worship, this is not restaurants, so it's more of our event centers. Whenever they're going to have more than 100 people indoor per room, they still would need to provide that 6 feet of separation. So there's a few businesses that I think impacts. I think Corinne has had a lot of connection with them, but certainly if you're on and you have questions, you can reach out and we can kind of talk through more specifics there. But those were the most significant components. Really all the other 5-star businesses still have components of 6 feet of separation, but it hasn't been as big of a detriment to them as it was the restaurant community, which still was seeing pretty significant reduction in their capacities. This is kind of the latest on how many audits and how many certified business. So we have 63 certified businesses within the county. And Corinne, any other 5-star things you wanted
We have
to
64. The Boulder Chamber became certified yesterday.
Oh, good job.
Woohoo!
You
No,
helped.
and I think I've talked to most of the 5-star businesses in the last week. If you have any questions about what 5-star clear means, basically it means that you're operating in the clear, but you're still following the checklists. And I sent out that information. It's all on the website. You're still following heightened protocols in return for the variance that's being allowed of you. But we appreciate that the 5-star administrative committee did take this step to allow some variance allowances for 5-star businesses. And we appreciate that Boulder County Public Health and that the Board of Health did allow 5-star to continue to operate within Boulder County. So again, keep emailing me, keep calling me. And I think I've talked to most of the event venues about the one clarification that did occur with the over 100 people.
Thanks, Corinne, and congratulations to the Chamber. Just again, a plug for the exposure notification system. Very simple app for you to add and as a resource to help with contact tracing and early identification of exposures. As of right now, we're still on that schedule where we're doing the Thursday sessions. I think we will definitely be reflecting, given that we are not expecting any significant changes. Now that that order is within our local control, we know much more what's going to happen. Really, the significant milestone between now and May 16th is at the beginning of May, at May 4th, 5th, is when our mask order will be reviewed. So that will likely be extended. Whether it is extended through the summer or just until May 16th has not been decided. So those will be pieces that will be still up for consideration, and we will definitely share those. But as far as dial changes, order issues, we're not projecting any more changes now until May. So finally a little bit of stability after a year of fairly instability in what was happening with those orders. And we haven't felt a need for the Friday session. We had that still flagged, but still have not seen anything significant to drive that. So we are not planning any Friday sessions at this time. And then the Spanish language session is pre-recorded and released today, and all those sessions are available on the Chamber's site. So with that, I'm happy to jump to any specific questions folks have.
And I think I prepped you for all the questions you were going to get are starting to come in. So when we moved to blue, I got a lot of questions this week saying, well, what does this mean about, are there any changes to what I have to do for service and all of this stuff? The move to blue on the dial just changed the capacities, but a lot of the restrictions are still in place, correct? We're still on the dial, correct?
So the county, when we adopted our local order, we basically took the state's 3.0 dial and made that our county order. There were a few exceptions related to how we dealt with our mask, which is a separate order. And then there's a component for larger outdoor events that do require anyone that's planning an event of 500 or more to submit that to the county for review prior to that event occurring. So those are the major changes. Otherwise, everything that you were doing before for protocols and prevention, those are still in place. And as Corinne said, as the dial status changed from yellow to blue, that just increased capacities, assuming you have adequate space to go up to that capacity. So we're still in that, whichever is the lesser. So if you have enough space to accommodate the number, then you can do that. But if you still don't, you're kind of still stuck at what your space can accommodate.
So speaking of the large events, so that 500 people or more approval for the large outdoor events, that's under the level blue, correct?
Yes, that's until May 16th. It also requires state approval depending on the size of the venue. If you have over 30,000 square feet, you will also have to get that approved by the state. So just as a planning tool for folks, we're not expecting that to be a significant delay. And if we're approving it, we expect the state to. But if we have concerns, we do expect the state will likely not approve it. So.
Did they plan for that to also be a case in level clear as well, if they have something
No.
after May 16th, or?
No, once we're in level clear, there will no longer be the dial 3.0. We will be encouraging folks to think about all the things that have helped prevent disease. So how you manage flow of people, encouraging mask use. Again, whether there might be the mask order, but certainly outdoors when you can't socially distance, as we're doing now, we encourage mask use, that good hygiene, all the things that help prevent this respiratory disease are still going to be important, especially if we see a plateauing, which we're concerned is happening with vaccination, that we're seeing specifically those younger age demographics starting to plateau on who's getting vaccinated. So if we aren't really able to get effective herd immunity, we're not going to get to that solution stage. So that being said, we don't still expect no new orders, but we still will have the disease and we won't really be able to ever get fully out of it.
Because we're currently still on the dial, we're still in blue, there hasn't been a change in the distance between performers and audiences. It's still 25 feet, correct?
Correct.
Or is it less? 25 feet?
For unmasked.
For unmasked. After that, we've gotten a lot of questions about what will it be under the new mask order? Is that something that's going to be looked at in the mask order when they go to clear? What's going to need to be the distance under the new mask order when you go to clear?
Yes, I think that'll be part of those discussions, because really right now the driver, I think, is that we still have dial components. And so as we move all those restrictions and just look at need for mask, I think we'll have to look at those distances for when there are situations that people would not be wearing masks, what distances need to be maintained.
I know I keep sending you those types of situations that keep coming in, like when we go to clear, what about this situation? And because the dial is the one that's governing that. So I know that under the new mask order, they're going to have to think about some of those.
Yep.
A question about, do we still have to use the space calculator to figure out capacity?
It's your best tool, but depending on what it is, there's a lot of caveats to that. So certainly indoor seated events, you just need to maintain 6 feet between um, groups, family groups. So it doesn't require you to have the same level of space to do some of those things. So it is not necessarily the requirement, but it's going to be your best tool depending again on what your business operation is. Where you have people moving around, that's going to be your best guide at how many people you really can accommodate and allow them to kind of move freely through your space.
All right. Large event venues do not include churches. What are recommendations for indoor church services at this time?
It's still very much the same, that keeping at least 6 feet between the family groups, making sure people are masked throughout the services, and not having any kind of communal efforts where if there's no sharing of drinks or cups or foods, self-service kind of things, really all the same precautions. There's no limit on number, as long as again your space can accommodate that amount of people and still keep the family groups separated. So those are the important parts. We know there was a significant Easter church service where a lot of people were unmasked, in the indoor. And so those are potential super spreader events. And so it is really important that people have both their opportunity to worship as they see fit, but not spread disease. So it's really, there is a happy medium there that you can do those services. You just need to socially distance and wear masks. It's really that simple, and certainly have good hand hygiene.
So let's talk a little bit about masks. If all of my staff are vaccinated, can I relax the mask guidance for my company?
No, so the 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 beauty of a vaccine is that it really is going to help the person that's vaccinated not get ill, or certainly not get significantly ill. It does not prevent you from getting ill necessarily, and it doesn't prevent you from getting the virus and giving it to others. So we have sectors that still have mandates that their staff are, even though they're vaccinated, are getting tested on a weekly basis. And we're seeing breakthrough where people are still getting sick, or they're testing positive because they're asymptomatic and have the virus, which again means they can spread it, but they are not sick themselves because the vaccine was likely impacting and not letting them get really ill.
So
So
even though the CDC has exemptions, Boulder County Public Health's mask order removed those exemptions and says, when indoors, you need to wear a mask.
correct, yeah, the only again exceptions are when you're alone in an office or building space. You can have a mask removed for the procedures, personal service kind of stuff where the people are able to take their mask off, but the workers still keep their masks on, and ideally even in respirators. So yeah, there's still not been a relaxation of that. And that's again on what the discussion will be even after May. Will we still continue with a mask component? Which again, to me, I know that a lot of people just really don't want to do this. It's such a simple thing to do that helps prevent the spread of this disease. So, and you can take breaks, you can take it off when you're outside. There's a lot of easy ways to get around not having to wear it continuously for hours and hours and hours, but it's such a simple tool to help prevent the spread.
And then do you have any idea of other things being considered in discussion about the mask mandate that's expiring on May 4th? Um, we talked a little bit about, some of the things that may be governed under the dial right now. Do you know how long we might be wearing masks?
I don't. It's going to be driven really by what's happening with the disease. So I think the biggest concerns are these variants that we're seeing. Those are the majority of the cases of illness. The hospitalizations right now have swung to be much younger demographic. So again, that's the concern with these variants, is they tend to make more people sick. They are impacting younger age demographics. More people that get it are getting sick, and some of them severely. So those are the concerns. And the biggest concern is that it continues to drive to a place where we see a variant that our vaccine is no longer effective at. So the more people allow the virus to persist in our community and spread, it's spreading very, very quickly amongst our youngest populations who aren't eligible to be vaccinated, largely from sporting and just other social activities from the age groups, that we could see something that breaks through that now our vaccines are not effective at. So if people have hated the last year, imagine doing this for a whole nother year, because now we have a variant that our vaccines are useless against. So it's really simple precautions that people just, for whatever reason, believe they don't need to do. And it's really, it's such a simple thing to do. But the vaccine is right here. It's in our community and people need to go get it. We're also hearing about vaccine appointments that are going unused. So vaccine is there, and it doesn't have unlimited shelf life. So it's really important that people sign up and actually follow through and get vaccinated.
So we ask this question a lot, and we're still seeing some confusion around this. Is a face shield a proper replacement for a mask?
No. So a face shield is a personal protective piece of equipment that somebody wears to protect their eyes and mucous membranes from, anything that could hurt you or impact you. So it's protecting the wearer from things that are out in their environment, whether that's a splash, say you're in a some kind of a chemical situation. It does not protect everyone from you and from your breathing. So that's what a mask is doing, is the mask is helping knock down the droplets coming out of your mouth so that you cannot spread those to others. And then the face shield is also not a respirator, which is your best protector, which is hopefully knocking down all of your droplets and also filtering the air you're breathing to protect you from what's in the environment, as well as protecting others from you. So those are the differences between those three things. And then masks are highly variable. If you're looking at a surgical mask versus something you made yourself or just some kind of handkerchief. So they vary in their ability to protect others from you.
All right, let's talk a little bit about May 16th. I have about 4 questions about that all say the same thing. You know, there will it'll be a we'll be moving to clear, most likely, hopefully, uh, but with mask, probably a mask order in place. So we're moving to a more normal, but with mask order. Will there be some best practices or recommendations for businesses on how to continue to operate more safely, public health wise, in the future that will come out when we move to clear?
Yeah, I don't think they will come out. They're already out. Everything you've done to help protect your business, protect your employees, nothing will have changed. The virus is still a respiratory droplet spread virus. So masks are the effective way to prevent your droplets from infecting others. Washing your hands is an effective way to make sure you're not picking up a virus and giving it to yourself. Screening your employees if they're ill is the best way to help prevent outbreaks within your business. Frequent hand washing, all those things. So there won't be any new guidance. It's really what you already have. And so they just will not be requirements anymore. So social
So
distance.
you're not basically saying these aren't needed anymore. You're just saying they're not required, they're recommended.
Yeah. And so, it's these are the same things so that have always been important to prevent respiratory disease. It's again why we've seen almost no significant issues with flu this last season, is because it's controlled the same way. So, but now we're moving back to that kind of place. And unfortunately, it will, if people don't do it, it will still increase the amount of disease in the community. But our focus is making sure the healthcare system doesn't get overwhelmed, not to have zero incidence of disease, but the community can easily create that. If you take all the precautions, you will prevent the disease, and eventually the virus dies out and there's nobody sick to give it to other people. It only can be sustained by us interacting with each other and spreading the virus between each other.
So it's just a little anecdotal story. When we did move to Boulder County 5-star clear. And I talked to a bunch of 5-star businesses and talked to them about, some of the things they could do a little differently. A lot of them said, we're not going to do that. We're not going to make the decision to move to 3 feet yet. We're going to continue to do 6 feet for the safety of our employees and our, um, we're not going to do this at this time. We're going to transition to that. But what it does is it gives your business the opportunity to make that decision to decide to continue to create some of these public health standards, to continue to create some of these safety standards within your business, to continue to follow the recommendations, to continue to do those health checks with your employees. As was noted by the epidemiologist a couple weeks ago, a lot of the variants, you see the symptoms in the variants. So doing the health checks with your employees, probably don't want to stop that on May 16th, right, Lane? You probably want to continue that. If your employee's sick, stay home,
Yeah.
right?
I
You want
mean,
to
it's
you want to continue those things into the future.
it's something ideally that you should build into your system to begin with. That the reason that you have significant outages of staff is when someone's sick that comes to work, they spread it to the other coworkers. They certainly can spread it to the patrons that you work with too. But the people that work together in close proximity for significant amounts of time, that's how flu is spread. That's how colds are spread. And so it's still an impact to both your business and to the community. So it's an advisable thing to do regardless. Our restaurants, our retail food kind of places, they need to be screening their employees for illnesses because of the risk of foodborne illness. So it's just important that protocols to have as part of your business anyway. And so a lot of those tools aren't that hard to implement, and they really are effective at preventing disease spread.
Well, and there's also the optics side of it too. All of a sudden on May 17th, if your business is all really packed, there might be those people that are afraid to come in. And also we have to remember that those 15 and under are not vaccinated yet. So there's that safety component that's still in place within our community, which leads to, so we answered a bunch of those questions. So they're removing the requirements, but there'll still be recommendations, and they're the same recommendations we've had before. Maintain distance, cleaning, employee health checks, don't enter if you're sick, wear a mask, which will be a requirement. Some of those same things that we've been doing for a year now, just they're up to your business to continue those protocols and those safety measures, except for the requirement probably of the mask. Okay, is Boulder County Public Health planning to partner with BVSD or St. Vrain or others for vaccine clinics to target those 16 plus?
I don't know if we will be doing any clinics. We continue to support all of our K through 12 schools, both public and private. So there's been a lot of work there. And I think, we didn't do clinics for their staff, but we did help facilitate getting providers to do vaccines for the various schools and school districts. So depending on, again, where we're at bandwidth wise, we will continue to support them, because that's an age demographic we absolutely want to get. And hopefully, again, even the younger age demographic. I see a question about, 12 to 15-year-olds. And I know that approval process is underway. I don't know when it'll come out. We are hopeful that it'll be this summer and before the next school year, so that we do have at least middle school and high school kids vaccinated. But we still have seen significant disease from that kind of 0 to 10-year-olds. So there's really no age demographic that can't get sick. And the kids can still be kind of spreaders to the rest of the community.
All right, a couple level blue specific questions. Are private clubs who are providing indoor tables for members, space being clean, 6 feet apart, permitted to allow eating and drinking? Mask, of course, required when not eating and drinking.
I'm not sure exactly what this would be, but I mean, it sounds like you're functioning as a restaurant would. So yeah, we would encourage you to follow all those pieces. That yeah, if you're providing indoor meals where your groups are spaced, by 6 feet, that they can eat without having a mask on. So I guess, similar to a business that has a break room for their employees, they obviously can take their mask off when they have lunch.
Okay. Buffets, do they still need to be served to the patron, or can they be self-serve?
Yeah, self-service is still not permitted under Dow 3.0, so that we're still in that phase until May 16th.
Okay.
And after that time, self-service is a high risk for a number of different diseases that are communicable. Norovirus probably being the biggest one, because that's a hand hygiene issue. And as those things are often not well maintained and cleaned, that you have a sick person come in and access and touch things, and then other people come in and get the same product. So that's how a lot of those communicable diseases are spread. So
Same with past hors d'oeuvres.
yeah, it doesn't really change the risk of any of them. It's just we'll be out of a phase where we're requiring you to stop doing that. So it won't change the risk if you start doing it again, but it will not be a prohibition starting May 16th.
So, but while we're in blue, you still can't do past hors d'oeuvres. They still have to be served to the person.
Yeah, there's no self-service allowance. The
Okay.
exception is sort of beverage dispensers where you're not touching any food and there's no utensils used. Those have been permitted for quite some time. So
water fountains, like the water fountain component, but if it's a water bottle, like if it's one of those water bottle fillers, you can do, but if it's the water fountain part, you don't want to have.
Yeah, I was meaning more maybe in a restaurant setting where people get a cup and they go up to the, and press the cup up against the dispenser to dispense their drink.
No, Wayne, you wouldn't believe how many water fountain questions I get a week. So
Yeah.
no, I was asking about the water fountain because I do get a lot of water fountain questions, but
Mhm.
the water bottle questions, we if it's that water bottle like self-service, but if it's the water fountain part, you still want to have that off. But then the self-service drink you can still have, but if it's any other self-service, still under blue, we're still under a dial
Yeah.
until May 16th.
But yeah, any dispensing that's kind of utensil free, you're not using tongs or scoops or things that everybody's going to touch with their hands, where you're just holding on to the cup that you're going to drink out of and you don't have to touch anything else. And again, it doesn't matter what the beverage is.
So self-serve for taps.
It'd be allowed.
Okay. How about ice machines?
Again, I don't know that their ice machine has ever been prohibited, so I don't know the situation there. But so if you're talking about a restaurant not being able to use its ice machine, that they could.
The ice machines with the scoops, I think, is the question. We had
So
talked about in the past having some
in
sort of
a
way to clean or wear gloves or things like
yeah,
that.
so maybe in the setting of a hotel that has an ice machine where people are going and scooping their own ice, yeah, that would not be something you should do. If it's self-dispensing of ice, then that'd be fine.
Okay. All right. Any other questions out there? I think I got through all the. Oh, so I think there was some confusion around real estate. So this happened when we moved from orange to yellow. So open houses operate under indoor events. So you have to follow the indoor events guidance, and showings no longer require a single family. They just have to make sure that they maintain distance. There's not those requirements on showings anymore.
No, you just would follow indoor events. So depending on the space, that would be the limit on capacity. So for ability to social distance and wear masks. But yeah, there's no
Yeah, the 50% and 107, that had to be a really big house to hit 175 people for an indoor event, a really big house. So
just
yeah, indoor events. So
just
yeah,
mask
I
it.
got a bunch of questions about that last week. So yeah, showings, you can have your showings, you can do your open houses, just follow those guidances, continue to do the cleanings, things like that. Is it correct for you can still do showings? You can still do showings even if it's not an open house, correct?
Yeah, all of those aspects. So kind of regardless of terminology used within the sector, you basically would follow the indoor events. So whatever the space can accommodate where people can socially distance and wear masks, that's how many people you would be allowed to have in there.
Yep. And it's when we move from orange to yellow that it no longer require that it be under a single family. So you don't have to worry about it. Like I think there was still the confusion that it needed to be a single family, but that's not the case anymore. Just, continue to offer. We just got another question about it. That's why I asked it again. Continue to socially distance, follow the indoor events guidance, continue to, follow those capacity limits, do the cleaning, all of those pieces.
Yeah.
Any other questions? All right. Well, we will continue on this schedule for a little bit longer. We're probably going to space them out a little bit farther apart in the future. Lane and I will meet and decide how that's going to work. Hopefully, we start to dial down the questions as we dial down the dial. Hopefully, we can get this. We can get this to the point in which we have less and less questions as we move to the clear on May 16th and continue to control the virus in our community. There are walk-up clinics now in the state of Colorado for vaccines. Those are on the state site. One of them is in Denver, one of them is in Larimer County. And thank you, Amy Aschenbrenner from the Realtors Association, that they just sent out to all the realtors the guidelines for open houses and showings to everybody on Friday last week. So I appreciate you sending that out because I was getting a lot of questions and I know you did send that out. I appreciate that. So if you have anybody that wants a vaccine, there are walk-up clinics. We'll continue to send the links. We'll continue to have these as long as there's questions, but we might space them out a little bit more and hopefully we start, like I said, to dial down those questions. We'll see everybody next week. I sent the link out for that. And thank you, Lane, as always. We'll see you next week.
Thank you.